Ladies and gentlemen, good morning. We are in Switzerland, so we will actually start with an on-time departure of the session. I'd like to welcome you to a session organized by DNDi called Advancing Global Health, Innovative Finance and R&D for Neglected Disease, an extremely important topic. We have a stellar cast of speakers as well, but we also realized that, it's morning, I don't know how late it was yesterday for you, so we'll do actually the inverse of what we would normally do. We'll let you relax and reflect on the problem first with a short, it's not a feature film, fortunately, with a video. And since much of it is really about the Dengue Alliance, as you will see shortly, takes place in Brazil, I'd also like to, extend a warm welcome to our friends from Brazil. Então, bom dia, bem-vindos em linha. So here we go. I think we're ready to project our movie.
Rio de Janeiro and Sao Paulo now both declared public health.
Nós tivemos uma situação de epidemia, que tivemos epidemia de dengue agora em Belo Horizonte nesse momento. Então nós pensamos em operacionalizar um hospital de campanha para tentar desafogar essa rede de urgência,
It's basically the worst outbreak in Brazil in history.
We are talking about 3,000 to 4,000 cases a day.
We actually have 3 times the levels that have been documented in the past, and 1,000 deaths already reported.
Foi piorando e quando foi ontem de manhã ele convulsionou, dispara um alarme, de repente evoluir para um quadro pior.
It's an infectious disease transmitted by Aedes mosquitoes. Right now, almost half of the world population are at risk of having dengue virus infection. It's a huge burden.
It's all hands and machines. Health authorities fight the latest deadline in Sri Lanka.
What is happening every year is the number of cases are increasing. It was a very urban disease, but now we see dengue outbreaks happening all over the country. We have this happening in all dengue endemic countries.
The incidence of dengue has increased tenfold in the last 20 years.
Despite causing havoc for over 30 years in Asia and Latin America, unfortunately we still don't have a treatment for dengue.
Então a gente já sabia que a gente ia ter um dos verões mais quentes da nossa história. E o mosquito Aedes aegypti, ele cresce e se desenvolve com muito mais velocidade no calor. Também tivemos chuvas intensas que provocou alagamentos em determinados bairros da cidade, o que facilitou o acúmulo de água parada e a proliferação de focos do mosquito Aedes aegypti. Mudança climática, ela antecipou a epidemia de dengue.
Eu pensei que eu ia morrer, eu digo, pronto. O delegado, assim, quando eu abri o portão para sair, aí eu caí nessa escada. Caí, não aguentei, não aguento não. Mas o que eu tô sentindo, eu não desejo para ninguém, nem para um inimigo meu. Um inimigo meu eu não desejava.
What people don't realize is people are unable to earn for a good 14 days.
Qualquer movimento que eu faço no trabalho é motivo para que eu pare porque eu estou sentindo dor. E é isso. Aí tu acaba perdendo porque você fica doente.
É porque as pessoas acham que nas comunidades, favelas, as pessoas talvez não tenham mais cuidados e por isso que elas têm dengue
E isso não é verdade. Eu estava tendo todos os cuidados, repelente, o que não falta na minha casa, e não adiantou nada. Ele teve dengue. Eu acho um absurdo os hospitais ainda não terem remédio para isso, né?
With dengue patients, you don't know who is going to develop dengue hemorrhagic fever or who is going to be all right. Anybody who comes with dengue, you have to monitor regularly.
The way in which we manage dengue, we stratify risk and we provide supportive care.
These healthcare workers do not sleep at all because of the amount of work that they need to put in.
We have enormous innovation happening in dengue, such as the Wolbachia-infected mosquitoes. These are mosquitoes that basically don't transmit dengue.
Wolbachia-infected mosquitoes are an excellent public health tool. The experience from existing programs show us there is an enormous impact in terms of the number of cases of dengue. At the same time, this comes with a cost for implementation. It takes time for their deployment. There has been great progress with vaccines.
But protection is incomplete.
They have different coverage of the different dengue serotypes. The distribution and implementation is complex, and it's likely to take a long time to make them available for all the populations that need. A treatment will still be needed. We need to treat dengue early to prevent progression to severe disease, to reduce the burden to healthcare facilities, to individuals and society. Among the learnings of the COVID epidemic is that actually we need different tools.
Can we develop a drug that will prevent people from going to hospital?
But also reduce the number of days in which a person gets sick. The NDI is an organization that is not-for-profit and that has a focus on developing treatments for neglected diseases. We operate in collaborations, what we call a virtual orchestra, with academia, with the private, the public sector, developing new treatments.
The NDI has formed this Global Dengue Alliance.
The Dengue Alliance was created so that we can develop the science to test drugs, develop the clinical trials to test these drugs, and eventually find the drugs which to test.
We have partners in Thailand, Malaysia, India, and Brazil.
Working in endemic areas, getting data in different regions on antivirals and host-directed therapies.
People realize from the COVID experience, either you came together to find a solution or you perish.
The NDI has allowed us to meet partners within the endemic countries as a collaborative network.
Is able to demonstrate there is enough expertise in this country to develop antivirus and develop the solutions for their own problem.
Things are getting worse in future because of climate change. With the increase in temperatures, the mosquito densities increase. They're expanding to new geographical locations.
The model suggests that it will continue to expand to Africa, North America, and to Europe.
The number of recorded cases this year is almost 3 times as many as that last year. Experts say climate change is partly to blame. Rising temperatures allowing mosquitoes to survive winter in larger numbers. Our next report takes us to
The way we do research needs to change. A global alliance is likely to find treatment for dengue much faster than individuals working alone. Nobody is safe from dengue. You could be the richest person, you could be the poorest person, and unfortunately people have died of dengue. It's not the time to wait until somebody else finds you a solution. It's about us finding solutions ourselves.
Thank you very much. I hope that we have both sort of eased your way into the session, but also driven home the importance and urgency. I mean, when you hit 10x, then clearly we need to do something differently. And it's always nice to have music in the background. The way we're tackling this is, of course, when we say we want more solutions, we will need more money, but we also might need to do some things differently in terms of process. And the NDI has kindly given us the task over the rest of the session, we have about 50 minutes left, to tackle this. We have 6 speakers, you see 4 chairs, so we don't play musical chairs at Building Bridges, so we actually have 2 of them online, as you will discover soon. And the idea is quite simple. The idea is to say we'll now hear from first from DNDi, how's DNDi tackling this? Secondly, we're learning from other examples, other models, and then in the last part of the session, we'll brainstorm with you because, again, it's a solutions-oriented session. We'd like to come up with new ideas, maybe new partnerships, new possibilities to jointly tackle this and other neglected diseases. And with that, without further ado, I'd like to invite you to another speaker online. Our first speaker is Dr. Kavita Singh, the South Asia Director of DNDi. Has an extensive background in the Indian R&D ecosystem, anything related to things medical, epidemiological. Essentially, she's an MD in that field as well, has also private sector expertise. And what I will not do is read all the bios in detail. Why? Because unfortunately, we don't have enough time for that, but you can find the bios online. So, Kavita, we're looking forward to hearing from you. Our format is 4 minutes, 4 times 6. It's very simple. And it'd be interesting to understand, first of all, give us an introduction to the work that DNDi does, and help us understand maybe what are some of the successes that we should bear in mind as we aspire together about how we can accelerate and be even more successful.
Okay, thank you. Can you confirm once if I'm loud and clear?
Yes, we can see and hear you. Brilliant.
Great. Morning, everybody, and miss being there in person, but my colleagues are there. So I like this task. I like this responsibility of introducing DNDi, and for doing that, maybe what I'll do is take a slight detour and talk about how new medicines are usually developed. While all of you might have some idea, but just to give a context, that this very complicated task, any researcher would say, takes about 8 to 10 years, and we usually think it's the pharmaceutical industry companies who have a very well-established pattern to develop them. So the pharma companies, they build expertise at every step. They would identify promising compounds, run extensive lab tests, animal studies, do huge clinical trials, manage the regulatory approvals, then go into a large-scale manufacturing, all things under their control, naturally, under the organization. But what it does, it makes the costs go really high, $1 billion or plus for a single new drug to market. Therefore, when you have so much at stake, naturally, the companies would focus on diseases that affect populations which have the ability to pay, because that's what justifies such enormous investments. That's the status quo. That's what had been happening. That's what happens all the time. But what happens when you're dealing with diseases that are primarily affecting low-income communities, and where their own indigenous pharma companies do not have the experience in developing new treatments? What do you do then? That's a question many of us asked. And traditionally, naturally, these neglected diseases, so-called, haven't attracted much attention, and therefore leaving millions without effective treatment. And that's where our organization like ours, which really steps in with what we call as an alternative drug R&D model. And in fact, if you hear about it more, you will understand that this, it was referred to in our movie also, that we do it through partnerships, and actually more 200 plus partnerships and global partnerships across different continents, bringing every domain expertise which lies with academia, which lies with researchers, contract manufacturers, even pharma companies themselves, because ultimately it will be them who will be making it available in the market, public health agencies, ministries of various governments. And by collaborating with these best skills and resources throughout the world, we achieve the same level of, I call it a scientific rigor, without really needing to own every piece of the process. So it means we do not really own labs, we do not own facilities, but our partnerships help us to deliver, and it's sort of a baton. We keep taking it ourselves, not passing it on, but we keep taking it ourselves to different experts. And it's a matter of pride when we talk about it, that in the last 21 years, DNDi has developed treatments for 13 such neglected diseases, certain indications, I will not say diseases, indications, and have saved millions of lives over these years. This approach has had a lot of impact because I've been asked to talk about a little bit impact. And one of the example which I really love to talk about because it belongs to the region from where I come. We worked again in the last 14, 15 years, collaborating with the South Asian health ministries, local researchers, clinicians, the WHO CERO of the region, the WHO country offices, and generated huge clinical evidence for a fatal disease which in our part of the world is called Kala Azar, but in the scientific world it's known as visceral leishmaniasis, and it's existed for decades. You know, it's a 95% fatality is if you don't treat these patients. So what it allowed is, and these regions are, you know, this is a vector-borne disease. So it means a vector can easily cross across borders. So it means any country could not work in isolation. So whether it's India, Nepal, Bangladesh, who share borders, they had to have a common elimination strategy. And at the same time, so we worked together with many of these countries, and the evidence we generated got integrated into their control programs, into their elimination programs. And it was such a matter of pride when last year we were identified as one of the stakeholders who helped achieve this milestone. Beyond this, we also say that, and our movie talked about it, that the climate health perspective is also changing the landscape of global health. And we are looking forward to this Dengue Alliance, which we formed about 2 years back to again deliver similar as what we did for visceral leishmaniasis. The other successes, another lesson we have learned is that drugs really matter during outbreaks. Yes, vaccines, we hear about it, talked very often, but you know, to roll them out for the immune response to come in, our collaborative method, which combines field experience, lab, production through pharma partnerships, can be very effective in saving lives. I think my time is coming. So just to summarize, I would say over the years, DNDI has demonstrated, we as an organization, that drug discovery and development is possible with the same rigor, because the regulatory approvals are same. You know, the drugs goes to a human. So the scientific standards or the quality cannot change through a very smart, innovative, alternative global collaboration. And when we pool resources, when we share knowledge, when we work with trusted partners, it is possible to deliver therapies, it's possible to reach elimination, and it's possible that an affordable and accessible drug to a population is made where it's really required, and they may not have chances of having it if such models do not you know, enter into the realm of drug discovery and development.
Kavita, thank you very much.
Thank you.
Thank you very much. And the thing is also, if you want to learn more, so you've really outlined the alternative drug R&D model of DNDI. If you want to learn more, I recommend reading the excellent annual report as a point of departure. And I know that Kavita is a seasoned yoga practitioner, so thank you for starting us off with, say, the tree pose, right? We have the mental clarity, we are concentrated, but now we need to move on to the next element, because all of this wonderful work needs to be funded. And I would like to welcome our speakers who are physically here now to join us. I think it probably makes sense if everyone joins immediately. And Tian will be next. I should also say that we will, enforce the time rule. Here's a picture of my yawning cat. If I show you a picture of my yawning cat, it means you are about to exhaust not the cat's patience, but your slot. Tian, you are the head of you're the fundraising coordinator of DNDI. We've just learned a little bit about the wonderful work that DNDI does. Help us understand how do you see the current situation? What are some of the things you should have on the radar? How are you funded now? How do you think, do you need to be funded in the future? What opinions do you see? Over to Tian.
Thank you very much, and thank you for the opportunity to talk to you. And talking after Kavita is always difficult because, you know, these are the researchers, this is the brain of the organization. So for me, I'm going to talk about money. Quite easy. So how are we funded? So budget of the NDI is between, I would say, 55 million to 75 million euro per year. So it's a middle-sized organization. We have been very, we are 20 years, a bit more than 20 years now, and we have been very, very fortunate to have very long-term sustainable support from some of the government, largely in Europe. So for many years we were enjoying, at that time I did not know that it was a nice cruise, but we enjoyed, 70% of our funding was coming from, I would say, long-term core funding coming from different governments, and 30% from private source of funding. But then COVID came. It started before COVID, but I think COVID really unveiled a very new situations in the world, but also for the donor, interest for the donors during COVID for global health peaked. Even for research, it peaked. There were discussions and interest about research. But then after COVID, time is much more difficult. And I think today we are more at 30% funded by those countries and 70% private. So to make it short, we need money. So to find that money, we started to be a bit more creative. Hardship stimulates creativity. So we've been working with, for example, we have enjoyed new relationship with pharma, for example, with Sanofi. We developed a treatment together with Sanofi for sleeping sickness, and we used together a new mechanisms that US FDA has put on the table to stimulate research for neglected diseases. And that, is a priority review voucher. So the company who is developing and registering a new drug for neglected diseases can have a priority review voucher to jump in the queue for whatever other product it has in its portfolio. And of course, because it's an American tool, then the companies have started to trade this PRV. So we have enjoyed is completely new source of funding from us, because we had negotiated with Sanofi to have a piece of this PRV. And we have a couple of products in our portfolio that could generate this type of money. But again, never enough. So we've been starting looking at impact investors. Ooh, new world, new words. We do not understand really this well. So we try to have some support. We have joined the III initiative, again, more as a learning curve. And one of the plea that I would like to have for you is, could you help us, organizations like us, to be better equipped to understand, communicate our value proposition to those kinds of investors? Because we are good at convincing traditional donors. I'm not sure we're good at convincing this type of potential investors. Thank you.
Thank you very much, Tian. So I think now we've understood sort of what DNDi does, why it's relevant, and also how you've been traditionally funded and the kind of funding models you are planning to develop, or you're developing already, but you want to ramp up. It's always good in this space to look at what others are doing. I think it's one of the fundamental principles of getting something right, seeing what others do well. And we're fortunate to have with us Raphael Ferry, Senior Manager of Innovative Finance at Gavi, who has a long, track record in impact investing as well, previously with Bridgespan, the MacArthur Foundation, Scheduled Capital Consortium, and others. Raphael, you're responsible currently for a portfolio of innovative finance efforts at Gavi. And I think it's interesting for our conversation to see a bit, how do you see this, right? I mean, what is the role? What works well? How do you convert traditional grantees? How do you develop others? What exactly do you do? And again, in 4 minutes, please. I know it's impossible, but oh well.
So as Max alluded to, I work at Gavi, the Vaccine Alliance. Just for context, we are a public-private partnership that emerged from market failure about 25 years ago, where manufacturers were not engaging with lower-middle countries for vaccine programs. And so there was incredibly fragmented demand. Funding was not available, and so Gavi came in as this aggregator of demand, creating a market that was actually interesting and relevant for manufacturers. and serving as this funding mechanism to actually deliver on this promise of vaccines for lower middle income countries. And so even at its core, this is a really interesting way of deploying finance to be more than the sum of its parts. I mean, you could target all of these countries individually, tremendous effort, not very effective, but by pooling this together, you're able to drive down prices, create an entity that has some negotiating power. And so I think even at its core, Gavi's a really interesting example of how you deploy capital in a new way. And so we've built on that legacy through a couple different ways. One is in terms of how we maximize donor contributions to our efforts. Another is being very efficient in how we deploy that capital. We've benefited from a great platform that allows us to securitize long-term donor contributions. So actually being able to access capital today to accomplish the goals of our donors that are paying upwards of 20 years for this impact. And so that's been an incredibly powerful way for us to scale up our impact much earlier than the cash flow that's coming in. A couple other examples I want to highlight very briefly around how we actually engage with manufacturers. We call this market shaping. And there are ways for us to deploy our capital that actually can deliver much more impact. When you're thinking about the negotiation with a manufacturer, they're dealing with different risks, manufacturing questions, reliability of the financing behind it. And when we're able to actually negotiate in advance, commit some of that capital early on, de-risk them, it provides much better terms, much better pricing, and we're able to deliver much more value for our donors. And so we do this bilaterally with manufacturers. We also look at this at a market level. The most recent example of this is stemmed from this incredible inequity we saw during COVID, where Africa was really left behind for COVID vaccines. And so we've launched a new initiative, an advanced market commitment, that is intended to catalyze investments into African manufacturing, solving that failure by having a pool of capital that actually shifts the trajectory of traditional investors into where they're going to invest, how they're going to look at the payout from investing in African manufacturing. So I just want to highlight very briefly how we think about the power of these innovative tools and deploying them in slightly different ways to deliver on our mission.
Thank you very much, Raphael. I think what we can really take away is you've done it. Clearly you've monetized the time value of money with great partners. You've done it at scale. Gavi is really famous for the AMCs, for the vaccine bonds. So much to be learned from. But of course, the challenge that we have is also slightly different because it's more R&D focused, not so much delivery focused per se. And it's always good to look at a couple of models. We'll go back from physical to virtual again. We have with us on the screen Andrew Nerlinger, the leader of the Global Health Security Fund, headquartered in Geneva, but currently with us, in the ether, joining online, and also a seasoned VC investor. Andrew, welcome to the discussion, and we look forward to hearing from you about your model and asking ourselves what might be applicable or translatable to the challenges and opportunities that the NDI faces.
Surprise, I'm here.
Oh, you're here, yeah. Oh, that's right, actually. Oh, wait, yes, you are here, but Harry isn't here. Sorry about that, yes.
I'm not sure if this one's...
You did not participate at the briefing. That's why I don't have it in the radar, but that's great.
I live about 5 minutes away, so it would have been...
Thanks for joining.
Easy
yes.
Not just come out.
Yay. No, everyone's awake. That's great.
No, thank you very much for having me, and thank you for the invitation. My name's Andrew Nerlinger. I'm the Executive Director of the Global Health Security Fund. We're a Geneva-based nonprofit formed in 2021, and all of our work is catalytic grant funding and then program development at the intersection of tech, innovation, impact finance, and health security. So this is a really good place to be, and building bridges is a fantastic event because it specifically brings together kind of those two strengths of Geneva, so really appreciate that. We did a session last year on innovation ecosystem, development. I won't get into what that is, but I recognize some people who were here last year. About halfway through, we had everyone stand up, form groups. This was a real surprise to everyone, so people couldn't just stay sitting down. And we had them form groups of about 5 or 10, and everyone, Raphael was there, went into the crowd, and we essentially had everyone give like a 60-second pitch about who you are, what do you want out of, why are you here, basically, what do you want right now, and then what are you prepared to give back to this kind of community that we have here at Building Bridges. And I thought that was a really nice exercise because it's something that we put into practice in the real world. So I'll talk about a specific example of what I think innovative finance looks like, with the specific message that what I've seen coming from a 14-year career in venture capital and a physician beforehand is that often the public health community doesn't always take the effort that it should to package the ask that it has in the terms of the people that are actually going to be writing a check to do what they want to do. And it sounds easy, but in reality it's quite difficult. And all of our fundraising has been through non-traditional funders in the global health security and the global health space, because we've been able to package things that look like something they're familiar with, whether it's investing in a startup or investing in an entrepreneurship program, things that look familiar to them, and that's really important. So going back to kind of that messaging, we took on in April a program that's now called BioPrevail, and it's been for 10 years a G7 global partnership program to improve the sustainability of diagnostic labs, looking specifically at biosafety and biosecurity labs. You know, the idea was it doesn't work to go put this expensive building in a country that can't afford to run it, and then it just sits there and everyone wastes their money. So how do you fix this problem? They'd been working on doing this as an engineering challenge for many years, but we came to the table and saw this as a finance challenge, quite frankly, not an engineering challenge. This was a finance challenge, a community development challenge, a training challenge, a misinformation challenge. The real thing we had to try to do was figure out how to break down this complex problem and put it into smaller bites that were accessible to people who might be able to fund parts of it. And so for the last six months, we've essentially been doing just what we had everyone do and stand up and ask these questions, is asking about 90 to 100 stakeholders in a customer discovery process, who are you, what do you want out of this, and what are you prepared to give back? And so we just yesterday actually launched our virtual platform for BioPrevail, where we're kind of essentially taking the next step building on that, because we notice clear trends. Some people want to fund engineering challenges. Some people want to fund misinformation challenges. Some people want to fund other random things we never even expected but wouldn't have known if we hadn't gone through this customer discovery process. And so where we are right now is packaging this bigger problem into a series of what we're calling sprint challenges that are very, very specific and include a funding partner, think like Global Affairs Canada, and then an on-the-ground implementation partner, for example, NICD, a big lab facility in South Africa, and then you know, all of the different community that's important around that. So you know, I'll stop there, but really what I think is important is to kind of really share and experience kind of new or kind of creative methods to bring non-traditional funders to the table here, because people, quite frankly, are tapped out in public health funding in a lot of ways. And I think it's incumbent upon us as a community, as a global health community, to figure out a way to meet them on their own terms. And I think that that's an important kind of take home I wanted to share.
Thank you very much, Andrew. I think this is a really important point. You know, we tend to think about it more from, say, the engineering perspective. What is it that needs to be done? And of course, dear funder, what should you be paying for and when? But of course, you know, ultimately one needs to also see the funders/investors perspective. Thank you for bringing that into the discussion. I think it's valuable for our, you know, a Q&A later, because it's a bit like clapping with one hand otherwise, which is nice. It's good exercise, but there's just not a lot of sound. Now, I assume that Harry Davis is then online, because I mean, otherwise I'll be a bit confused. We wanted to make sure in the session that we look at different models, specific models. And Harry is a principal at PRI Investments, Seniath LLC, I think London-based. And Seniath is really an impact-first single-family office of the Diana Eisenberg, and you know, her foundation. And I think it's interesting for us to understand how an actual impact investor would look at these kinds of opportunities, and you know, what model they apply. So over to you, Harry. I hope you're online. I think so.
Yeah. Good morning.
Brilliant.
Everyone.
Excellent.
Sorry, I can't be there in person, but some family commitments kept me back in the UK this week. So. So a couple of thoughts, I guess, to practitioner in this space, you know, with actually like a multi-sector remit, but increasingly oriented towards health. So I think One point is, and this sort of builds on what Raphael said, that impact finance can really help solve market failure through intentionally investing in targeted solutions that can be scaled in sectors like health, and embrace the spectrum of capital, both traditional philanthropic dollars, more commercial capital, but actually this big pool it sort of sits in the gray area in between of more catalytic capital sources, which often family offices and private foundations are increasingly leaning into, sort of embracing the spectrum of capital to try and leverage as much investment into important areas like public health as possible. And I think one observation as a sort of active investor across multiple sectors globally is one of the challenges I think with scaling these interventions in health is the market is structured a bit differently. If you look at other sectors like financial inclusion, agriculture, off-grid energy, you have a fairly sort of standard investment model of a lot of companies of different stages of maturities that are able to access equity and debt capital markets through funds and ultimately through banks as they scale. And if you look at most of the successful interventions in sort of global public health from an impact investment perspective, they've all been pretty unique and structured quite differently. Things like Gavi, things like Med Access. And I think some of that is because of the need to sort of, either put significant dollars into R&D, but also invest in distribution at really large scale in a way that isn't maybe true in sort of more fragmented sectors. So I think that's one interesting observation. I think a second thing, just drawing in some of our learnings across other sectors is, there's a real opportunity for nonprofits across the spectrum like DNDi to lean in, to leverage their existing philanthropic dollars and try and combine them, particularly I think with more sort of impact first catalytic capital that maybe doesn't have incredibly high return expectations, but does want to, preserve its value and be repaid eventually. To leverage their philanthropic sources and try and accelerate progress and get to scale more quickly. I think it's important this is done responsibly, and actually from experience, usually our sort of non-profit partners, big global actors like One Acre Fund, people like Save the Children we're working with at the moment, are actually some of the more kind of responsible investees we have, because I think they tend to embrace risk but responsibly in a way that conventional for-profit companies are sometimes guilty of not doing so. I think there's lots of ways to think of this. In the health context, there's been some limited success with things like development impact bonds or social impact bonds in more developed markets. I think the ability to leverage tools like priority review vouchers is really exciting, and maybe sort of pooling like capital around that to try and sort of scale the deployment of that resource is really exciting. And I think again, like a lot of philanthropists, particularly given DNDi's sort of evolving philanthropic, private sources, are incredibly passionate about health outcomes, and trying to encourage them to embrace the full spectrum of their resources, I think is really important, beyond their traditional sort of, giving away 5% each year or whatever it would be. And then I thought I'd just end on one sort of specific example from our current portfolio in health, which comes at things slightly differently than DNDi, but I think with some common characteristics. And so that's by a fund manager called Cross Border Impact Ventures, and their thesis is, I guess, rooted in similar paths that certain populations get left out of the mainstream of much kind of R&D around drug development. Their thesis is actually through more of a gender lens, so that even in developed markets, in North America and Europe, a lot of sort of solvable problems are not being addressed, facing women, adolescent girls and children. And the really unique thing about their model is they're looking to sort of support businesses, who are sort of getting through that early R&D phase and entering a scaling phase in those markets, but also work with founders who have a real passion for transmitting that technology to the global south, in particular in sub-Saharan Africa. And so that's been a really interesting model we've supported. And I think for any investors in the room, what's interesting about that sort of blend of philanthropic and investment capital is public sector actors through the Swedish and German governments have basically taken the vast majority of the risk out of that fund investment we've made. and also actually provided some return enhancement features. So, you know, ourselves and other investors are actually getting like a pretty reasonable deal for, you know, which on the surface might look like a very risky, you know, sort of new fund strategy. And so I think the world of blended finance means there's a lot of actually really interesting opportunities for people to deploy investment capital, you know, responsibly. Thanks.
Harry, thank you for sharing. I think what I take away is there's a lot of passion. You know, the macro trend is certainly, as you said, you know, embracing the full spectrum of capital. But of course, it raises the question, you know, what do you prioritize? How do you do it? To Andrew's earlier point, how do you make it compelling also for an investor? And how do you actually translate that into actionable strategies? I'm delighted that we're helped in figuring this out by our last speaker on the panel, last but not least, Eric Berset, who is the founder of Philanthropy Advisors. We've had the pleasure to collaborate in the past on a project with the ICSC. You know, Lombard Odier helped to design and bring to market the world's first, well, I guess, humanitarian impact bond, even though it's not a bond, but a well. And you know, Eric's firm played a key role in this. Eric, when you hear all of this, you know, you've incubated WHO Foundation, you've worked with the, you know, brightest and greatest in advising them. What are some of the learnings that you would like us to walk away with as we, you know, move over into the discussion based on your broad experience? You know, he doesn't have gray hair, but he should, given the experience. So I guess it's a wonder of nature as well on that front. Over to you, Eric.
Thank you very much, Max. And the watch suddenly disappeared on the timing, so but I see it's back on, so I try to be brief and keep it to the 4 minutes. I think what I can share maybe is some of the trends, because I think we've been hearing a lot about the ones who are on the receiving end of the equation. But I'm happy to share some of the trends that are around philanthropy giving and what are some of the innovations that came out of it. I think, and I'll share 5 brief points, but the first one is most of philanthropists today, whether foundations or individuals, are engaging not only in blended finance, but blended approaches. So blended finance, yes, different financial products, but also they're engaging in different types of grant-making opportunities through different intermediaries, through collectives, through different funds. They are operating with small grants, big grants, grassroots organizations, big UN organizations. So the way philanthropists are engaging today is really, I would say, very diverse and multidimensional, and definitely a blended approach. They also tend, and it has been mentioned also before, but that they tend to be working around collaboratives. They sit together, they work together from the private sector, from foundation, philanthropic sector, government sector, implementing partner sector. Now I think in the past 10 years, all these different actors have learned that they should not work in a silo, but work together to basically bring the best that they can within this impact ecosystem. One of the other points is the shift towards systems change. I think now we are looking not only at addressing specific issues, but everything is about moving or addressing what are the gaps within the system, and that goes also working with the different actors and at different levels. One other element, which is the third one, is on outcome-based approach, and I think this has been mentioned yesterday also. People want to have metrics, they want to have visibility on impact, they want to be able to communicate and understand about how they can improve, and I think what you were referring to, Max, about the humanitarian impact bond is something that was absolutely key in being, or for the outcomes funders to be refunding the investors. The fourth one is on the intersectional approach and the climate nexus, and this has been mentioned as well. I think we cannot be looking at SDGs on each of them, even though we can deep dive in each of them, but they are all interrelated. I think the example of the NDI is very interesting, because if you have, dengue fever, for example, this is affecting education. People who are sick cannot go to school. Parents who are sick cannot provide for their kids or for their families or for their households. So everything is interconnected across the different SDGs, but I think also what we have seen in philanthropy in the past years is that climate is very much embedded into all philanthropies, whether it's on specific vertical programs, that are tackling climate-related issues, or across the different programmatic engagements that are happening. If you are not putting climate into your planning for the next years, you are not planning for the planet or for the world that we are going to be facing in the coming years. And I think this is absolutely key, and it's not only about climate, but it's how climate affects all these different topics. And the last one, maybe, that I can mention is on the technology leverage. We've seen also on all the different circuits of big events that AI is a big topic in all the different discussions. I'm not sure it's solving for all for the moment, but there are some technologies that are definitely going to be key, and especially with the next gen, they are really looking at how they can be integrating this in the way that they operate. And we have we've been working with Eric Schmidt, former CEO of Google lately, to see how we can embed some of these technologies in humanitarian responses. So engaging the private sector, whatever type of competencies they have, to engage in, or better engage in humanitarian responses through the integration of tech that, again, will not solve it all, but that will be helping having more efficiencies in it.
Eric, thank you very much. So lots of opportunities. The challenge is, of course, how do we get started? The good news is we did respect our timing on and off, so that means we have time for a Q&A. And while you think about your first question, I'd like to ask one to Tian, because it's all about getting started at the end of the day, understanding the point of departure. So has DNDi already worked with Swiss-based foundations? If so, can you give an example? And what is your experience? You know, after all, we do have almost 14,000 charitable foundations in Switzerland, so I would have hoped that you had at least one among your donors.
Yes, so the answer is yes. We've been working with Swiss foundations. We are located in Geneva, by the way, just next door from here. It was not far away to come. So, and we have a good network in Switzerland. So we have engaged with some foundations that, you know, I will not name, so sorry for that. But we have also engaged with, for example, the UBS Foundation that has supported the work on pediatric HIV that DNDi has been doing. So answer is yes, but I think not enough. Okay. Yeah, and I think there is also, as for the rest, but there is also a problem, and I think it was really nicely said, of how do we present what we're doing and how do we present the impact that we are doing, knowing that our R&D work can span over 10, 15 years, which is usually not necessarily what foundations in general, Swiss foundations also, are looking for. So we're looking for more engagements and happy to continue if someone is interested.
Excellent. So timing consistency needs to be addressed, more people at the table. I would say over to you, dear participants. As a reminder, as you know, questions end with a question mark, not with an exclamation mark. So we're not looking about long statements. Do we have questions? Yes, and you have micros, so everything should be plug and play.
Hi. I just wanted to pick up on the point that the gentleman on the left made about public health having crossover with other sectors. And I wonder if you're finding that, for example, investors who are invested in petrochemicals or natural resources or other sectors of the economy effectively need to pay a premium for public health in order for their sector and their investment to return what they expected. Is that something that's happening?
So that the question is for me?
So is the question, yes, the question is for you or the other panelists, or if it's something that you've experienced.
I would suggest we take maybe 2 or 3 questions and then allocate, if that's fine. The lady in the second row and then the gentleman in the third row.
Yeah, hi, thank you. My name is Beatrice Vetter. I work for FIND. We're an NGO very similar to DNDi from our operating model, working on better access to diagnostics. So I have a question to anyone who wants to take it on the panelists, but so there is an international organization called Health Finance Institute, and they're looking at developing a health impact credit, okay, which would be great for NGOs because that's a way to monetize what we do, right, saving lives and averting deaths and so forth. Is there anything that you've come across in any of the conversations you're having with in your resource mobilization strategies, particularly with the private investors, right, and where obviously the climate impact sort of credits are quite useful and used? And any comment on that would be interesting because it could be wonderful, but it has a number of challenges, of course.
Okay.
Thank you.
Thanks. My name is Adebayo Adekola. I work with UNICEF. My question points to the conversation around packaging for investors, because I think that is one area that, we continue to package things in our own language, and sometimes investors are, looking at how it would, advance their own vision. But the question I do have is, what can you, speak more about that packaging beyond just startups and entrepreneurship? Because I think that everybody's doing challenges, everybody's doing early stage, and there is little focus on actually the delivery and the last mile. So the question is, what does that packaging actually mean in concrete terms? So that's my question.
Thank you very much. I think we have 3 great questions. I think the first went to you, Eric. And then, I would say, feel free to allocate the question on health impact credits and basically packaging amongst yourselves. But, maybe we'll let Eric start.
So thank you very much for your question. I think 3 elements to answer your question. So we are at Philanthropy Advisors, so the consultancy I'm running, we are working with a large set of businesses who are willing to engage or who are engaging in impact-related issues through their corporate philanthropy, CSR activities, sustainability, etc. Things have been moving a lot within companies. So maybe 3 elements, and then I'll answer your question. So first of all, I think if you ask all the NGOs who are in the room and outside of the room, they all have their own enemies, so to say. Well, like, it's not enemies, but like they are fighting against some of the corporates. If you speak to, MSF, for example, they have a big issue with pharmaceutical companies when it comes to licensing. If you speak with Handicap International, you would, they would have issues working with Airbus because weapons manufacturer. If you speak about, all environmental organizations, obviously oil and gas would be a concern, etc. So I think the right question here is basically how we do bring these actors into improving the state of the world. And I think putting them outside of the loop of the discussion, and I think this is really what has been changing in the past years, but putting them outside of the discussion is not going to get them moving in the right direction. And this is what we have decided at Philanthropy Advisors, and what I have taken from working at the ICRC for several years on the ground is that we want to speak to everyone and try to bring them on some of the issues that can be in corporate philanthropy first, but then can come within CSR, more sustainability activities, and then can be spoken on specific supply chains, etc. And I think this discussion is really important to have. There are obviously some boundaries for some organizations, and I did not mention, for example, tobacco, but for WHO, obviously, receiving tobacco, or even some, Danone, Nestlé are very controversial for WHO when it comes to WHO code and breast milk substitute. So again, I think here the idea is really to see, and the example of WHO and Danone has been very good in discussing how they can move the needle into having a better health-related agenda. So first point, everyone has its own, black sheep, so to say. Second is we need to bring them alone rather than putting them on the side. And then when you were speaking about taxes, we haven't been encountering, beside the United example, where there has been, they've been partly financing through tax-related issue. I think there's probably more productive ways to engage, and this is an innovative way to address it, but I would not, focus only on, petrochem, oil and gas. I would open it to all different business. From my experience, creating incentive is always more productive than creating barriers or taxations when it comes to engaging the private sector. Hope I'm answering your question.
Yeah. I'll take the third one since we're going down the line very quickly. You know, we're talking about impact investing. We see it in our ecosystem approach as a continuum, right? So a lot of times you might have grant funding filling out kind of the early stages of de-risking and innovation. And then we think that the private sector increasingly, as you go along that spectrum, has a responsibility to look at the scaling aspects of it. So when we're talking about impact investing, it's not just pure returns-based investment or philanthropy. It's kind of that mix of both. Looking at kind of the packaging, though, it doesn't have to be really complicated. Even this week, I've gotten some proposals from like WHO looking at, where they talk about the importance of the work they're doing, and then the final result of the pitch or the presentation is we need more money. And I think that really just doesn't cut it nowadays. You have to really articulate, what do you need the money for? What are you going to do with it? How much do you actually need? Where are we going to send the check? That's not easy to sort out always. And then what is the responsibility that you have to feed back metrics, and what metrics are you going to use? So there's a lot of things we're expecting and getting used to seeing in the venture space, where if I saw a startup deck that didn't have any of those things in it, I wouldn't even look at it. And I think that now there's a compulsion for, people to be a little bit more detailed on the back end, not just explaining about why what they're doing is so important, but thinking maybe why this should be important to an investor and how you're going to actually meet those goals and find some way to meet in the middle. So when I'm talking about packaging, it doesn't really have to be that complicated. I'll probably stop there in the interest of time, but happy to talk about that more.
Yeah, I just want to pick up on that a little bit. I think the language is incredibly important, and we often talk about investors in public health. Private equity are not investors in public health. They might be partners in public health, but I think that's a really important distinction. And we need to reflect that in the language we use, and I think that when taking an analog from private equity, when you look at something what's important in your product, you're looking at an acquisition based on how they rank on key purchase criteria. Are they over-indexing on what people really care about? And I think we need to be really diligent in making sure that we're trying to hit the right marks when we're speaking to a new partner. And if it's truly an investment that's going to deliver them a return, we can talk about it as an investment, and something along the lines of shared value and how this creates something of value to them. But I think I was at an impact investing conference, and some of our materials had, we want you to invest in us. And that's going to start off on the wrong foot, because they will look at this and think they're going to get a return, an ROI, a financial return on their investment. And it's going to take a while to get back to what we're actually talking about. Just on the health impact credit question, I'm not that familiar with it. I think it's a great analog to the carbon credit market, which I think arguably is still nascent. So I don't have a great reflection on that one, to be totally honest. Thank you very much. I think, the good news is we're on time. The bad news is we're almost out of time. I think, our speakers have really delivered on the Einstein adage to say, make things as simple as possible, but not simpler. We know it's complex. You've managed to, fit it in. The good news is, I think that our friends from D&DI will still be available upstairs in room 11. So that's great. And I'd like to also briefly, acknowledge our mastermind for the session, Stuart Short, who's put all of this together, and ask you, Stuart, if we think about it, what have we heard today? We've heard that D&DI, of course, has a great track record. The tectonics of the funding situation are changing. You need innovation in how you fund yourself. Innovative finance, impact investing is part of the solution. But at the end of the day, your core activity is an R&D activity that therefore takes a long time, has high risk, may create value, commercial value further down the road, but it's complex. So that means you need specific types of capital, not any form of impact investment. You're not a social service business, for example. So Stuart, maybe very quickly, since you're working on this with D&DI, what do you think would be most helpful at this stage for D&DI at this next iteration of modernizing its funding model?
Well, thank you, Max. I think the important thing from D&DI is to bring into this space new partners and funding partners, because the traditional funders that they've had are not going to be in this space really, and we don't want to cannibalize those funders and tell them that we'd rather you do something different as opposed to just grant making to us. So it's important that we have discussions like this. D&DI in its nature is a not-for-profit. There isn't any profit in research and development in neglected diseases because of who those neglected diseases are hitting and impacting mainly. So it's difficult for us to look at in this impact investment space because there is no, effectively, at the moment, really an outcome payer in providing that sense. So again, it's something we want to bring in new partners to the group, and I encourage everyone basically to, if you have any further questions, just come and see us in room 11 after this session. We're there till about 3 o'clock, so let us know. But it is, it's been a very important session for us, and I thank you all basically for attending, and and thank you, Max, for actually coordinating this as well.
Thank you very much, Stuart. Please give a hand to our speakers. Thank you for joining. I think it was a great discussion. You know, there's still more time here at Building Bridges, so don't hesitate to seek out people. If I don't stop on time, I have to show the picture of my cat to myself. So I'm ending the session here. Please enjoy. Thank you for joining, and all the best.
Thanks.
Merci.